8:12 Thursday morning, joined by Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
Good. You have a nice 4th?
Yeah, it was very nice. Lots of fireworks.
There you go. And hopefully some barbecue and some rest as well. Well, making plans for your future health care helps ensure that your preferences are known and respected. And it's never too early to start thinking about the kind of care you want. Dr. B joins us, People's Health, discuss the importance of advanced care planning. Doctor, I guess we'll start with the definition. What is advanced care planning?
Yeah, sure. So this is a really important topic, and advanced care planning is really just a way to make sure that your wishes for medical care and any kind of treatment that you may want are known and understood. And what's really important about it is, it's really about having conversations with the people that are closest to you, with your friends and family, so that they understand what those preferences are and really what the goals you have as you age. And this is really important, especially if you have chronic health problems. It's all about making thoughtful choices, and really creating advanced directives to outline those wishes.
What is that, an advanced directive?
Yeah, so advanced directives are really how you express, what your desires are for your future medical care. And they are actually written instructions that you actually create in order to list your preferences that you want followed by all of your healthcare providers. And the advanced directives are actually recognized by the state of Louisiana, and they're a really important guide for your doctors, but also for your family who may have to work with your doctors on your behalf, for your future care, especially if you're unable to. And there's really two main types of advanced directives. The first one is called a living will, and the second one is called a healthcare power of attorney.
Go into that a little bit more, if you will, please.
Yeah, sure. So a living will actually outlines the medical treatment you either want or you don't want to receive. In a situation where you may become physically or mentally unable to actually communicate your wishes to your doctors or to your family. And then the healthcare power of attorney, what it does is it actually appoints a specific person to make medical decisions on your behalf. And again, this is only if you're not able to make decisions for yourself. If you're able to, you obviously will make those decisions. But in the event you're not able to, you want to have that person who's going to advocate for you and actually follow what your wishes are.
Why are these advanced directives so important?
Well, what's really important is you have the right to make choices about your medical care, and really live, your life on your own terms. And so planning is a way to just maintain your control over that and to ensure that you're comfortable in a health crisis. And, making decisions about your health care can be really emotional for your family. And it can be difficult to carry out your wishes if you've never actually discussed them with the family or written them down or anything. So creating these advanced directives really helps your family better support you and your wishes. And sometimes it can even take away the burden that they may have in that kind of at-the-moment decision-making required.
Yeah, it would seem like one of the nicer things you could do for your family, because then the onus is not on them. They don't have to make the decision. You've already made it, right?
Yeah, absolutely. And like I said, this can be a really difficult time. And so you don't want to put your family in that situation. You want to make sure that they know exactly what your wishes are.
Is this something that only older adults need to tend to?
No, that's a misconception. And actually, advanced care planning is not just for older adults or even for people that are extremely ill. You can actually start creating advanced directives at any age or really any stage of health. And the earlier you start, the better. It's really important to plan when you're able to carefully think about and talk through a lot of your preferences and write those plans down so that everybody knows about them.
How do you even begin to start this process?
Yeah, this can be a very difficult and emotional process. And so, the first step you want to do is take a little bit of time and sit down and just think about what your options are. There's no single list of questions that you want to answer, but there are a couple of things to think about. One in particular is how comfortable you want to be if you're in an acute or a critical health situation. you want to think about what kinds of treatment you either want or you don't want. And then some people don't want to know specifics about their conditions. They want someone else to know about their condition, but not necessarily have all the details themselves, because that can be very difficult as well. So you can make that decision too. And then, like we talked about with the power of attorney, you want to know who is going to make those decisions if you're unable. So if they've got to make difficult decisions about treatment, you've got to assign that person and give them that power to do that. And then, the last question you want to ask yourself is, where do you want to spend your last days if you are in that sort of situation? Do you want to spend them at home, in hospice, in a hospital? So these are all things that you have to think about, difficult questions, difficult answers, so that you know exactly what you want to do.
I guess you'd want to kind of sit down and talk this over with your family and your loved ones?
Yeah, absolutely. And, and those conversations are critical. They're very important, but they can also be extremely difficult. And, disagreements, especially in the family, can be a very normal part of the process. But what's so important is just sitting down with your loved ones, letting them know what's important to you, and maybe have a little bit of debate with them as well. The conversations are really your opportunity to express your wishes, and help your loved ones understand them.
And again, as far as taking it out of the family's hands, sometimes siblings will disagree if you don't have these things in place, so that kind of helps keep the family together as well. You got any tips for handling these conversations?
Yeah, you're absolutely correct. These can be difficult, and so sometimes what I tell people is you may want to start with a practice conversation. You may want to sit in front of a mirror and kind of have that conversation, see how it comes out. Gives you a chance to practice a little bit. And when you do actually talk with your family and your loved ones, you want to do it in kind of a quiet, comfortable place. Hopefully at home, maybe a favorite restaurant or something like that, somewhere where you feel safe and at ease. You don't want to just kind of squeeze this in as an incidental conversation, because it's so important. And take it real slow, too. You don't have to discuss everything in a single conversation. You can initiate a conversation, kind of see how your family reacts, and then, continue these one-on-one conversations as you go along. One other thing that's really important is take a little bit of time to listen to your family as well. So while you're having those conversations, your loved ones are going to have very strong opinions, most likely too, and they may make some really good points that you want to think about, maybe some things you haven't considered, so take that into account. And then, the most important thing to remember is that this is kind of a ongoing process. Nothing you decide is permanent, and so you can change your mind at any time. You can have those conversations over and over again. Your initial thoughts are really not set in stone.
All right, let's take a break. We'll digest what we've heard so far, and we'll pick it up with what comes next after having these conversations with your loved ones. We're talking with Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, about advanced directives and making sure that you got the care that you want set out as you want it to be set out. 821 traffic now, WWL. 825, Tommy Tucker, WWL, back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking about advanced care planning. We've gone through the steps, and we've had the conversation with our family. What comes next, Doc?
Yeah, so after you've had those conversations and really thought about your options, the next step is to talk to your doctor. And, sitting down with us, what we're going to do is we're going to listen. We're probably going to ask for additional details and help kind of clarify specifically what you're thinking. We will help you write it all down, kind of point you to some areas with maybe some helpful resources if you've got any decisions that haven't been made or things that you're uncomfortable with. And then we may raise any conditions that we may have, about any medical concerns that you're thinking about. Now, keep in mind, too, some people may want to talk to their doctor before having the conversation with their loved ones, just to kind of understand a little bit better how to have those conversations. But there's really no right order for how to do this. What's just important is making sure you think about what you want, talk to your family, and then talk to your doctor about it.
Can you do this during a regular appointment, or do you schedule a special appointment for this?
Yeah, I mean, you absolutely can talk to your doctor about this at any visit. You may, if it's going to be a longer conversation, you can actually schedule an appointment that's dedicated to advanced care planning. Just when you call to make the appointment, tell the front desk that's what you want to talk to the doc about, and that way they can be a little bit more prepared as well. It really just depends how long you feel like you need to talk to your physician about it.
So once you create these directives, what happens?
Yes, I mean, this is a document, so you want to make sure that everything is written down. You want to make copies and store them in a safe place, just like you would a regular will. And you want to make sure you give copies to your family, especially that person that holds the power of attorney. You want to give a copy to your doctor, and you can even give a copy to your health plan, and they'll keep it on file as well. But, what's really important to remember is that advance directives, like I said before, they're living documents, and your wishes certainly will change over time, especially if you have a major life event or some change in your health. You may want to review those preferences that you put down and make adjustments to them. So really on a yearly basis, you want to revisit this document. If you decide that there's some things you either don't want or new things that you do want, just write them down, update everything, and get copies back out to everybody.
People's Health has some resources available for this, Doc?
Yeah, we do. Online, all this information and more is available at peopleshealth.com/advanced care planning. And the page really has resources to help with those conversations. There's actually video resources as well and links to some aids that can actually help you start formulating what those plans are and how to have these conversations. And those are accessible to everybody, not just People's Health members.
And while it's a conversation you may not look forward to having, and it may not be very pleasant, the best thing I think you can do for your family is to have this conversation, have these directives in place so they know what you want. They're all everybody's on the same page, right?
Yeah, absolutely. I mean, you're really doing it for them so they know exactly what you want. And, another thing to keep in mind is if you are the child or if you are the loved one, there's nothing to say that you can't start these conversations with your parents as well. It may be a difficult conversation to have, but it is important just so if you do get in a situation, you know exactly what to do.
Once something is done that would be against a patient's wishes, it's a lot harder than not to have it undone than not having done in the first place, right?
Yeah, absolutely. Yeah, you can't go backwards, and so you want to make sure if there's something you want done or something that you don't want done, if you're in that situation, you want to make sure everybody knows about it.
Thank you, Doc. Appreciate your time. Some very valuable information. We'll talk to you again soon.
Thanks, Tommy.
You bet. You can go to peopleshealth.com to find out more about advanced directives or about People's Health.